Hi, I'm Dr. Russel McDonald. I'm a practicing pediatrician with 36 years experience. The following podcast is directed at expecting parents and provides information useful to them after the baby arrives. If you would like more information or to schedule a free Meet the Doctor visit, you can contact us on our Facebook page at Plano Pediatrics, our website planopediatrics.com, or by calling the office 972-596-2131. Good evening. I'm Dr. Russ McDonald, or you can call me Rusty. That's what my grandchildren call me. My credentials are I went to Trinity University, UT Southwestern Medical School here in town, Children's Medical Center here in town, and private practice for the last 36 years. But my real credentials are I have 3 grown children and 3 grandchildren. And that probably taught me more about the stuff we're going to talk about tonight than going to medical school and residency. Because we're going to talk about things you're almost certainly going to see in the next 2 months. Who's due in the next few weeks? Nobody? So good. So the next couple months, most of y'all are going to have a baby. And the first thing we're going to talk about is picking a pediatrician. And I'm going to give you 2 levels of things you should think about. One is what I consider absolutely required, and the other is my opinion. Absolutely required, board certified pediatrician. Number 2, on your insurance plan. And that's a little trickier than it sounds because the big insurers, United, Cigna, Aetna, Blue Cross, sell lots and lots of plans. So you could call a doctor's office and they say, do you take Blue Cross? And they could say yes. And you could get there and they're not on your particular Blue Cross plan. So you want to make sure that the doctor you pick is on your specific Blue Cross insurance plan that you're signed up for. You can do that online usually, or you can call the doctor you know and ask them to check. Okay, subjective, the things that I think are important. My number 1 is running on time. Your time is important. Your wife's time is important. You're going to be at the doctor a lot. And if you have to wait an hour every time you go, you're going to get real annoyed. So I like doctors personally that run on time. You're going to want a nice, clean, happy, cheerful doctor's office. You're going to be there a lot again, so why not? You need a doctor you can talk to. If you think your wife, or in your case you, have had a lot of questions, wait till you have that baby. However many you've had during the pregnancy, you're going to have 10 times that many with your children. Okay, so somebody you can talk to. You want somebody that's reasonably convenient. Now that's harder than it sounds because you've got your home, you've got where you and your wife work, and then you've got daycare where the baby's going to be if you're going to use daycare for your child. So you have to pick a spot that's reasonably convenient for all 3 so you can get your child and get to the doctor as needed, or to go to the doctor and then go on to work or whatever. Okay, how do you find out those things? Get some names from your friends, from OBs, and call a couple of the doctors and schedule a get to know the doctor or a prenatal visit. It's usually free, not always, but generally for free. The doctor will mark off 15 minutes or so to talk to you about whatever you want to talk about. So here's what you find out when you call. Were you put on hold for 20 minutes when you called? Or did they get on the phone promptly? Were they easy to work with? I need to come in on a Thursday. That's a good day for y'all. Did they find you a Thursday? When you came in, did you have to wait an hour to meet the doctor for this prenatal visit? So a couple of prenatal visits are real helpful in deciding whether or not you're going to be happy with that physician's office. So those are things you want to look at doing. You're going to be at the pediatrician a lot. So that's real important. That's also why phone service is real important. When you call your pediatrician, you should expect to be called back. If you call during the morning, by lunch, and if you call in the afternoon, you should be called back by the end of the day. You should never call your pediatrician at 3 in the afternoon and get a recording that says, hello, any calls after 3 o'clock will be returned the following day. Now, in the adult world, they get away with that. My GI doctor does that. You're not going to be happy when your pediatrician, you call at 3:01 and you're told you'll be called back tomorrow. So you should always be called back in the morning if you call in the morning, afternoon if you call in the afternoon. So returning phone calls is another thing you want to look for during the day. That's going to be a biggie. And I'm not talking about your bill and your insurance. I'm talking about medical issues. So now you've picked a pediatrician and you come into the hospital to have your baby. Your wife goes into labor. You do not need to call your pediatrician and let them know. The nursery nurses here will let your doctor know, and they know your doctor's call coverage. They know who's on call Christmas Day, who's on call Thanksgiving, so you don't have to worry about that. That will happen automatically when you come into the hospital and have a baby. Okay, so you're here in the nursery, and two things are going to come up almost for absolute certain that are going to cause you and your wife anxiety. The first is breastfeeding. Now, you're going to go over breastfeeding tonight. You're going to get all kinds of helpful tips. But the most important thing to remember when you go home, your wife says, what did the doctor say? It's that your wife's milk is not going to come in for 2.5 to 3 days after delivery if you have a vaginal delivery, and 3 to 4 days if you have a cesarean section. It just takes a while. Now, your wife will have colostrum, which is high protein, high fat milk for the first couple of days, but there won't be big volume. So what's the natural consequence of your baby getting small volume, highly concentrated breast milk? The baby's going to lose weight. Now, this is going to make your wife very anxious. She's already nervous about breastfeeding. Her milk's not in, and the doctor comes in and says, the baby lost 3 ounces. Your job is to say, well, Dr. McDonald said that was going to happen and we shouldn't worry. Breastfed babies normally lose 5 to 8% of their birth weight routinely, and we don't really get too concerned at all till they lose at least 10%. So if your baby is a 6-pound, 4-ounce baby, which is conveniently 100 ounces, so I can do that in my head, your baby's going to lose 5 to 8 ounces routinely and could lose 10, and we wouldn't even be concerned. Every day when your doctor comes in, your pediatrician will know how much your baby weighs, what percentage that is, and talk to you about the breastfeeding. I know your big concern will be getting your wife's milk in so the baby can start gaining weight. The way you get the milk in is to feed the baby frequently, again and again and again. If the baby's sucking on his or her hand or finger, put them on the breast. If the baby's vigorously taking the pacifier, put them on the breast. If the baby's fussy, assume the baby's hungry, put the baby on the breast. Because more often the baby eats, the faster your milk's going to come in. So I'm going to exaggerate, of course, to make a point. An hour of breastfeeding, 30 minutes on each breast, every 6 hours is not as good as 30 minutes of breastfeeding, 15 and 15 on each side, every 3 hours, is really not as good as 10 minutes on each breast every 2 hours. Now that's the same number of minutes per day breastfeeding. It's the number of breastfeedings you want to do. So what you want to do is get your wife to feed the baby again and again and again, and that's what gets the milk in. So that will take 2 to 3 days to come in. Don't be alarmed. The other problem that comes up almost all the time, and if any of y'all have friends who have babies or brothers and sisters who have nephews and nieces, it's almost all babies get jaundiced. Jaundice is a condition caused by bilirubin. It's a substance that builds up in babies' blood that makes their skin yellow. So if you've ever been around a 3, 4, 5, 6-day-old, you notice they all have a little yellow hue to their skin. That's called jaundice. That's normal. And your doctor will be keeping a close eye on that and let you know if the baby's getting jaundiced enough that we need to do something. You see, what would we do? Babies go under something called phototherapy. It looks like tanning bed. If you've ever seen a baby under what looks like a tanning bed, that's ultraviolet light that you use to help the baby lower the jaundice level. It's safe, it's effective, and your doctor will know exactly what your baby's jaundice level is the day you go home, so you don't have to worry, okay? So you can ask about it, but your doctor will stay on top of those two things routinely. So next thing, you're going to have a visit a couple of days after you go home, and that is really, really important because that's when we're going to check and make sure your wife's milk is in, make sure the baby's gaining weight, make sure the baby hasn't gotten jaundiced, and maybe most importantly, give you a chance to ask questions because you're not going to have a lot of questions in the nursery because the nurses are there, people are checking on you all the time, coming in asking, do you have questions? Well, wait till you go home and have a couple of nights home with just you and the baby. You're going to have lots of questions. So you're going to come back a couple days after you go home, check the weight, check the jaundice, and answer questions. Now remember a little while ago I told you you're going to be at the doctor a lot. Let me define a lot. 2 days after you go home, 2 weeks, 2 months, 4 months, 6 months, 9 months, 12 months, 15 months, 18 months, and 2 years if your baby never has a problem. Okay, so you're home, you've had your visit 2 days after you go home, and the baby is gaining weight and not jaundiced and your wife's milk in and everything's cool. Let's talk about some issues that are going to come up in the next month. First, let's talk about baby poops. Now, baby poops is not very exciting business, but there's one thing you should know. I'm assuming everybody here is going to breastfeed. All the women are going to breastfeed. And the reason I'm going over this, when babies first have stools in the nursery, they're about the color of this one. Very black, tarry, kind of like road tar, that stuff they fill cracks in asphalt with. That's what your baby's poops are going to look like, okay? Then they're going to become kind of black-green, and then green, and then brown-green like this guy's hat. And then they're going to get yellow. And the reason I'm telling you that is not to tell you about the color, just so you'll know what's going on. But then you're going to think your baby has cholera. Do you know what cholera is? Cholera is the world's worst diarrhea. Your baby's going to be pooping 8-10 times a day, and it's not going to be formed. It's going to look like watery yellow yuck. That's normal for breastfed babies. So there's no need to run to the emergency room, no need to panic, don't think your baby's sick. That's normal breastfed stools. Now, what's it going to look like? When you get home, this is the best analogy, tell your wife, go in your refrigerator and get out your French's mustard plastic squeeze bottle. Don't shake it. Turn it upside down and squeeze it real hard, and what shoots out is going to be what your baby's poop is going to look like. So that'll be the best thing I can tell you to prepare you for changing diapers. They're going to be running down the leg, up the back, all over the whole body, and you're going to think, surely this isn't normal. It's normal, nothing to worry about. So that's baby poop. Next is sleeping, or I should say not sleeping. Now babies sleep fine in the daytime. They eat at 8, sleep till 12, and they eat at 12, sleep till 4. Your friends come over and your relatives and they go, he is such a good baby. He just sleeps, he's so happy. Well, that's because it's daytime. Then all of a sudden it gets to be 8, 9, 10 o'clock and their little eyes go. And all of a sudden they're up, they want to be held every second. They want to be walked around, patted, and eat every hour and a half for the next 5 hours. So you're going to get lots of bonding, quality time with your baby between 9 or 10 at night and 2 or 3 in the morning. And the good news for you guys is it only lasts 2 months. Now that doesn't sound like very long. Wait, it's going to seem like a real long time. But after that, babies start sleeping a little better during the night, staying up a little better in the day. But there's about 6 or 8 weeks of up pretty much every night, night after night. Nothing to worry about. Okay, some people prefer to hold the baby up over their shoulder, looking over the shoulder. That's a good position for padding and burping. I just find that the fussy baby likes being held in the crook of the arm with arms and legs folded, facing outwards. This is similar to the position all of your babies are sitting in right now inside your abdomen. Their heads up, their arms and legs are crossed. They can hear and feel every beat of your heart, every breath you take, and every word you say. Now, it's 2 in the morning. The baby's been in your arms quietly for about 10 or 15 minutes, and you lay them down. Whack! You pick them up. They're quiet and happy. You lay them down. Whack! They're quiet. That is not a fussy baby. That is a normal baby. Remember, have you ever heard the expression, be careful what you wish for? Everybody in this room wanted a baby. Everybody's getting a baby. So that is not a fussy baby. A fussy baby is a baby that cries and cries and cries no matter what you do. And there was a developmental pediatrician named Barry Brazelton in the 70s, 80s, and 90s, maybe early 2000s, who once defined a fussy baby as a baby that cries for more than about 2.5 hours a day. I don't know if Dr. Brazelton was right or wrong, but that's a good number. If your baby's crying for more than a couple hours a day and nothing's making them happy, you probably ought to contact your pediatrician. There are 3 or 4 things that can do that. Number 1, a hungry baby is a grumpy baby. A baby that's hungry fusses. Now I know you're going to hear doctors warn you about overfeeding. Don't overfeed the baby. I have found that the overfed baby grumps a lot less than the underfed baby. So when in doubt, feed your baby. If their baby's been fussing, you might think, well, he or she just ate an hour and a half ago. They couldn't be hungry. Don't assume that, particularly at night. So feed the baby again. So if your baby's fussing day after day and you can't seem to get a handle on it, schedule a visit with your pediatrician. After the first week or 10 days, your baby should be gaining an ounce per day minimum. So if you were there 2 weeks ago and your baby's now only gained 6 ounces, your baby's probably not getting enough to eat. Should have gained about a pound, 14 ounces. Okay, underfed. Number 2, some babies are real sensitive to what's in your diet. Milk protein and soy protein in the mother's diet are 2 big offenders. So if you have a fussy, colicky baby that cries and fusses all the time, you might want to have your wife talk to her about taking all the milk and soy out of her diet. Cheese is okay, but no milk, no ice cream, no real creamer, no soy, no tofu. If you look at something, think that's basically milk, don't eat it or drink it. Unfortunately, it takes about 2 weeks for that to help. Next thing, this one's harder. And it's reflux. You know, when I say reflux, what I mean, I'm talking about heartburn. Lots of people get heartburn. I get heartburn if I drink coffee near bedtime. And all babies spit up. So when a doctor says reflux, that's secret code for spitting up, okay? So, because I'll have parents come in and say, my baby spits up almost after every feeding and my mother wanted to know if he has reflux. Well, yeah, reflux is spitting up. So all babies have reflux or spit up to some degree. But for some reason, some get heartburn. It's hard to know. If almost every baby spits up some, how do you know which ones are crying because of heartburn or acid reflux into the esophagus? You don't. It's a little bit of a guessing game, but there are medicines you can try for heartburn in babies, and your pediatrician will be familiar with those medications. Lastly, I'm going to tell you something I don't believe in, but you're going to hear about it, so I might as well tell you in advance. And that is, there's a lot of grandparents and aunts and uncles who believe that gas is the problem. That if you could just get rid of the baby's gas, they wouldn't be fussy. Now, we all know that all boys, from the day they're little to the day they die, pass gas. All men pass gas, right? All children pass gas. Point I'm making is everybody passes gas. So why would a baby passing gas make them colicky? So I'm obviously not on board with the gas theory of treating colicky, fussy babies. That said, there are 2 products on the market you can buy and try. One is a product called Mylicon. It's in your baby book in the section on colic. You can buy it across the counter. It's Simethicone is its generic name, and you can try that. And the other product is called Gripe Water, G-R-I-P-E water, which is basically Alka-Seltzer for babies. So you can try Gripe Water or Mylicon if your baby's fussy, gassy. If it works, you're a star, right guys? You hit a homer, the baby's not fussy. And if it doesn't work, you can secretly mumble under your breath, Dr. McDonald was right, it doesn't help. Now I'd like to go over a couple of common questions I receive. First is mom's diet. Should there be restrictions regarding milk or soy while the woman is pregnant? And the answer is there are no recommendations to do that. Research shows it does not appear to make any difference, so your wife can eat or drink anything she wants within reason, and then we'll restrict the diet if the baby has symptoms suggesting we need to. Another question involves why are babies most active in the evenings? I'm not sure. I've never read a scientific discussion of the topic, but I will tell you for a fact that all 3 of our children were more active in the evenings, and I've always felt that babies, after they're born, are continuing something they started long before they were born. Thanks for listening. I'm happy to share this information which will make your transition to new parents as smooth as possible. If you would like more information or to schedule a free Meet the Doctor visit, you can contact us on our Facebook page at Plano Pediatrics, our website, planopediatrics.com, or by calling the office, 972-596-2131.